Hello, I'm Kaustubh from Medicover Hospitals, and this is Medicover Podcast. Welcome to our new episode of Breastfeeding Week podcast. So, just to give you an information, this is a breastfeeding week from August 1st to August 7th. We conduct a breastfeeding week, and this podcast is going to be about how breastfeeding helps mother and children and why it is so important right now in today's world. So going ahead with Dr. Tanmay Sahu, he is our NICU in charge with more than 15 years of experience and going ahead with him. So sir, yes, can give you an introduction.
So hi all and welcome all to this breastfeeding week. And myself Dr. Tanmay Sahu. I am a consultant neonatologist as well as a consultant NICU in charge and also a lactation consultant who has been helping out mothers and helping out mothers to breastfeed and improve their breastfeeding quality and also give awareness to all the mothers who have these issues in breastfeeding the baby. So coming to the breastfeeding awareness week, that is like every year we have a particular theme. For example, this year we have the theme of closing the gap. So the closing the gap means there have been a lot of lacunas or a lot of quality indicators that shows that as per the NFHS 5 statistics, there's a lot of difference between how many babies have been fed within the first hour after birth. That thing is completely higher in the urban area, but it is lower in the rural area. But the other thing, how many babies have been exclusively breastfed for the initial 6 months? So exclusive breastfeeding for the first 6 months of life is very important. And for that quality indicators, it says that like rural or just above the urban counterparts. So it could be of many reasons. Like in an urban area, we can see mother going to office works early, a lesser number of maternity leaves being given to them, and the organization structure or where they have been working is not conducive to them. It is not giving them proper workplaces where they will be allowed to breastfeed the babies. So there are a lot of gaps in which. So we are working for the awareness to increase the awareness in such educational and institutional counterparts, so that this statistics or the quality indicators will improve. So basically this is an awareness week, and I would say not only the August of first week, rather every day, every year would be an awareness thing, because it is not like that for the first week only we'll give an awareness, but definitely we can just inculcate in all the parents or all the would-be mothers, so that they would follow this thing. It will be helpful for them and their baby as well.
Sure. So you just said something about that. I can say collectively about one thing that I heard is that urban parents are losing out on breastfeeding rather than rural parents. Rural parents are actually winning out on breastfeeding. Like rural mothers are most probably giving much more, preference to breastfeeding rather than urban area mothers. So this is coming to that one thing. Just wanted to understand what is the actual benefit of breastfeeding towards the child and as well as the mother.
So, see, breastfeeding is a right of the baby. Breast milk is the right of the baby. So, as we know, breast milk starts secreting from around 5 months. It's not just after delivery. Mother can have this lactogenesis kind of thing where the milk get production from 5 months onwards. So, when a baby gets delivered, basically baby needs to breastfeed within that first hour. So we have this concept of something called as a golden hour, that is within the first hour of birth the baby should be sucking onto the breast of the mother. It is not required whether the mother to have a milk output or not, but at least the baby should suckle onto the mother's breast, and this suckling will give one stimulus so that that mother will have this continuous production of milk, and the habit of breastfeeding will never let it down. So switching over to other breast milk substitutes, which is more common in these urban areas, that thing will reduce to a greater extent when we start breastfeeding within the first hour of birth, whether the delivery is a normal or whether it is a cesarean section. In both the things, it is possible to feed the baby or breastfeed the baby within first hour. That is what is called the concept of golden hour in these babies.
Okay, so first 60 minutes are the most important things when a child is delivered and when they are coming into this new life. The first 60 minutes are very crucial towards their health and all of the currently, if they are finding any kind of a disease or if they are prone to any disease, these diseases can be prevented through breastfeeding that you are saying.
Yes, definitely. So there are list of diseases. In fact, there are many diseases. So I would like to focus some of the important things. When a mother breastfeeds exclusively to the baby, then baby will have lesser number of respiratory infections like pneumonia. It will be lesser. Those respiratory infections which would require hospitalizations will be also lesser in those babies. Second thing, these babies who are completely fed on breast milk will be lesser allergic and will have lesser eczematous conditions. These rhinitis, allergic conditions will be lesser. They will have lesser amount of diarrheal episode, as diarrhea is one of the most important disease that causes mortality in under 5 babies. So this can prevent diarrheal episodes to a greater extent because it matures the gastrointestinal tract of the baby. Second thing, it prevents dental caries in the baby. It also prevents acute otitis media, that is ear infection. Many a times, many babies complain, my ear is paining, dard ho raha hai. When they go to ENT, they find some fluid in the ear that is called otitis media. So that can be prevented with breast milk only. And other most important thing, it prevents SIDS. SIDS is something called as a sudden infant death syndrome. That is a baby, everything is good, was doing good, was at home, but suddenly collapsed without any reason. So these things can be prevented with breast milk only. And most importantly is that all breastfed babies will have a higher IQ points, like 5 to 10 points higher than their normal counterparts who are on substitutes. And most importantly, one more thing is that these babies who are on breastfed can have decreased chance of this leukemias, something called as acute lymphocytic leukemia, that is a type of blood cancer that is also decreases to the child. So apart from all these things, these are the benefits to the child, but also they have benefits to the mother as well. Like in mother, we can see there are 2 cancers that can be prevented, or in fact that incidence will decrease more when the mother is on breastfeeding. First thing is a breast cancer. So it is said that if there is a cumulative period of 12 months where the mother has fed the baby completely on breast milk, the chances or the incidence of breast cancer reduces by around 4.2%. Same with the ovarian cancer. Even if a mother has fed for 12 months, the chances of the risk reduction of this ovarian cancer comes to around 28%. Third most important benefit for the mother is it gives a period of lactational amenorrhea. That means a period where mother cannot get pregnant. So it will help in spacing of their births. So it is not only applicable in urban, but it is applicable everywhere for rural areas also, because you don't want to have a kid when your own kid is 6 months old. So this spacing of pregnancy is done by breastfeeding. And apart from all this thing, the emotional bonding that is only possible through breastfeeding. It is important for the development of social and adaptive behaviors in the baby later on.
So the major importance which I can collectively understand is that mothers should do breastfeeding because they can avoid having breast cancer, as well as you said that it is 4% chances that it drops down, they don't have breast cancers, and 20% chance that they don't have ovarian cancer. As well as you just said something about that it is giving a space to control the birth.
Yes.
As you said that it is very important to give care to the first child rather than just having childs after child. So yes, this is one kind of, I can say that it can be called as a birth control.
Yes.
Collectively. Okay, so now we have understood about mothers having the benefits and children having the benefits about it. What are the things that are important in the sense like when to start breastfeeding and when to stop the breastfeeding?
So when to start, as I have already described, it should be started within the first hour. We should not wait for anything, except the fact that various conditions, like when the mother is very sick, mother has got admissions into ICU because of some critical conditions, then we might have to wait for some few hours when the mother gets stabilized. But if the mother is okay, even in cesarean section, within the first hour, attach the baby or let the baby crawl onto the mother's breast. Let's do the breast crawling for all the babies. It is possible, damn possible in every case scenario. So within first hour, baby should breastfeed. And so far as stopping is concerned, no guidelines or no books ever say stop breastfeeding. Okay. It is like to continue breastfeeding as and when needed. But as per WHO guidelines, they say at least 2 years old. At least till the baby is 2 years old, continue breastfeeding. So they have used the term at least. But
according to guidelines of WHO, World Health Organization, they say that minimum 2 years
should be given.
Maximum, there is no cap on it.
Yes, there are many case scenarios we can see in US and like in Finland and Sweden also. Mothers are breastfeeding to both their babies. Like one baby is 7 years old, one baby is 3 years old. They are breastfeeding both of them. They don't have any issue.
So this is something that I learned for the very first time.
So breastfeeding, there is never an end point to breastfeeding. But yes, there are some at least 2 years mothers should breastfeed.
So now we have covered out the topics which were when to start and when to stop breastfeeding. Now, our our audience would like to know what are some important foods that are necessary for good breast milk, or good kind of breastfeeding for mothers.
So there are no particular foods that the mother should eat. Mother should take care of a proper balanced diet. There are no food restrictions as such कि हम ये नहीं खाना है, ये खाएंगे तो बच्चे पे असर आएगा. So that is not like that. Mother should take all the nutritious food what she used to take when she was pregnant or even before that, because breastfeeding a baby is a calorie consuming process for the mother. So mother needs extra calories. So any good food with good balance of vegetables, good balance of proteins and carbs is good requirement, and good amount of water. Water intake should be good enough, because water itself acts as a galactogog. So what does a galactogog does is that more of water, it helps in more of milk production. So basically this will help for the continuation of breastfeeding. So nutritious, well balanced diet is what a mother needs.
Okay. So as I said, that the most important thing that or all the pregnant ladies should consider is to consume a proper amount of water, as well as a proper nourishment and proper nourished meal. Balanced diets is something that we should take care of. Now coming to the next point is that a lot of mothers go through cesarean procedures when they are giving birth to their children. So what for them, what is the consensus of breastfeeding for them?
See, it has always been an issue, even in tertiary hospitals, that we have seen cases, and even in some of these awareness are lacking among the nurses or the healthcare workers as well. They feel that when a mother delivers a baby through cesarean section, mother cannot breastfeed the baby because mother is in kind of pain, mother is say sedated, mother is anesthetized, or some kind of pain is in there. But this is completely a misnomer or a wrong thing. Baby can be fed breastfeeding directly to the mother even when the mother goes through a cesarean section. There are various breastfeeding positions that can be given, like a laid back position or a biological nurturing, where the mother sleeps in the bed. Mother need not to sit down, need not to bend the incision or stitch sides. Baby can be brought up onto the chest and can be allowed to breastfeed. So there is never a contraindication. Cesarean section is not a contraindication to breastfeeding the baby. We should not also need to wait till the mother becomes mobilized, mother gets mobilized, or mother gets able to sit down to breastfeed the baby. That is not required. Even a mother sleeping on the couch or sleeping on the bed can breastfeed the baby. There are various positions that we can use that we have been using in our hospital, that we have been trying to, even in LSS mothers, we have been trying those breastfeeding positions to feed the baby directly from the mother. So that is completely wrong that LSS or cesarean section mothers cannot breastfeed.
Okay, so is there any specific time window that they are given, or instantly after the procedure has happened and they have gone through the cesarean procedure, everything has been sewed up? Is it possible for the the mother to at the moment give the breastfeeding, or they have to wait for some time and then start the bit?
See, as per these BFHI, that is baby friendly hospital initiatives, earlier it was said that for a normal delivery, say we should breastfeed within 1 hour, and for cesarean section we should breastfeed within 4 hours. But now the recent recommendations what they have come up with is that we should breastfeed as early as possible. So how as early as possible is not defined, but yes, you can attach the baby to the mother's breast, allow the baby to suckle on, because a drop of milk is colostrum, that is important for the baby. Even it is not that mother will start secreting a lot of milk from first 2 hours, but even 2-3 drops of colostrum is sufficient for the baby, because as we know, we can show you some pics with that a baby's stomach is only like a cherry on day 1. The volume of the stomach is just like a cherry. It is 6 to 7 ml only. So that drops of milk is sufficient for the baby. So we should be assured, and that awareness has to be with all the healthcare workers.
So going ahead to the next question is that I have seen recently while going through the gynecology department that some of the women who have been facing with some problems while they are breastfeeding. So what are the common problems that women are facing when they are having childbirths?
So first thing is, the common problems they face is improper latching. So they do not have proper attachment, the proper positioning for the baby to latch onto the breast. That is a major issue. Lack of awareness, especially for the primary gravida mothers, or the first time mothers, they face these problems a much larger number of times. And some mothers might have some nipple conditions, like anatomic conditions. We can say some mothers might have this inverted nipple, flat nipple, pseudo inverted nipple, or a retracted nipple. So that has to be examined by the nurses or the lactation consultant who are there, and mother has to be counseled, because for every of these nipple conditions, the only treatment is proper positioning and proper latching. If you do a proper latching, then baby will suck onto the nipple along with the areola to suck on the breast or total amount of milk that is inside the breast. And for every, so for example, if there are issues like a completely inverted nipple, so we have some devices, we have this nipple pullers, we can use some of the maneuvers like RPS is done, reverse pressure suctioning is done, and also proper attachment, teaching the baby or the mother both how to hold the baby, how to hold it erect, and how comfortable you can sit. Helping out mother in all these conditions will actually are the main solutions of these short-term problems like this short nipple. These all things are short-term problems, and it should never be a barrier between the breastfeeding. It should never be a barrier.
Okay. So I think so most of the questions have been answered by Dr. Tanmay Sahu. Thank you so much for having us today. And also, if you have any questions or if you have any comments regarding to breastfeeding, or if you are currently going through any problems, you can always ask your questions in our comment sections. We will be happy to answer you. Always, if you are in need of any kind of consultation, you can always connect with us at Medical Hospitals, Kharghar, Navi Mumbai, and you can always consult to Dr. Tanmay Sahu. He is always available with us. Thank you so much.
Thank you very much.